lot of people talk about COVID-19 that it advanced the use of telehealth throughout the country, right? But what COVID-19 really did is it illustrate the importance of delivery of care over administrative stuff such as regulatory, reimbursement, turf protection. So you look at Korea is a good example. Telehealth was illegal until recently. And the reason why it was illegal is because the medical association refused to endorse it. And there was nothing wrong with the technology delivery of care. It was just a turf issue, right? So slow uptake of telehealth has never been due to technology or clinical limitation. The technology has always been there.
It's very important that with the physical distancing and people actually afraid to go to hospital right now, it is a special time that become a leapfrog for the telehealth. But not only that, because the remote monitoring and AI, IoT, it's also quite a leapfrog, like around 3 to 5 years. So we are seeing something that haven't been before. It's a combination of virtual healthcare. So it's tele with wearables, IoT, and also the on-demand.
The cost-wise, I think it will be quite reasonable or acceptable. So there's a few ways you can do it, like from in terms of stages. So you are there when things start to connect into your infrastructure-wise. You are more or less ready to be in the next generation of the Wi-Fi 6 technology, which is IoT and all those things coming in. I mentioned to you, you still have time now because most of the device is not so ready to the Wi-Fi yet. So we still have some maybe 1 year to implement or maybe 2 years, so your cost can be well spread.
Number one, elderly patients, some of them might not be technological savvy. They might have a smartphone and all those things, but they might not necessarily download your platform to engage you through telemedicine. Second, I would think that medicine is a very broad practice. There's certain limitations that weigh heavily, especially for the surgical disciplines. In fact, it's very limited for them in that case that they only see review cases in which might not necessarily need a face-to-face visit.
The factor would be internet access, right? So when I say access, I really mean like 4G, the ability to see each other clearly via a smartphone, right? So penetration of smartphone is also the other important factor. In my opinion, I think the third factor, which is the education, is something that is actually the most important ingredient in that sense. Are they educated enough in the sense that to telehealth, to healthcare in general, to say that hey, I want to seek help from a telehealth platform, or actually to some extent, have they even seen a Western medical doctor before? And that really directly influenced the rate of adoption of telehealth in this country. In more developed markets, I do see a lot more higher rate of growth at this point in time, but I think the rest of Southeast Asia definitely is catching up.